Are you trying to ignore the tingling or numbness you've had for months in your hand and wrist? Or that sudden, sharp, piercing pain that shoots through the wrist and up your arm? You may have carpal tunnel syndrome.
Carpal tunnel syndrome occurs when the median nerve, which runs from the forearm into the hand, becomes pressed or squeezed at the wrist. This nerve controls the feelings in the palm, side of the thumb and fingers, but not the little fingers, and some small muscles that move the fingers and thumb. This tunnel is a narrow, rigid space of ligament and bones at the base of the hand. It houses the median nerve and tendons.
You may be wondering what could lead to carpal tunnel syndrome. Here are some activities that might lead to it.
Oh, my wrists tingle and I have sharp shooting pains on my arm. Oh, these nursing care plans. I've been doing this daily journal for the whole day. So many mess. My wrist hurts.
All right, oh yeah, take that. Oh, ouch, that hurts. Oh.
Sally, you went over your texting this month. Get off that thing. Of course, sometimes doctors can't find a cause.
So, who's at risk? Adults. Women are 3 times more likely to get carpal tunnel syndrome than men due to smaller carpal tunnels. Diabetics or people with other metabolic problems. Assembly line workers, and people who like their hobbies that are hand intensive.
I think I have carpal tunnel syndrome. What should I do?
Some non-surgical treatments include over-the-counter medications, various prescription medications, exercising, including stretching, strengthening, some alternative methods including acupuncture and yoga, splinting your hands at night, and using ice packs to reduce inflammation.
There are surgical treatments as well. The surgeon will open up the wrist and will cut the ligament to enlarge the carpal tunnel, which relieves the pressure on this median nerve. This can usually be done as an outpatient surgery.
If you're worried about yourself or a loved one, here are some ways you may be able to prevent carpal tunnel syndrome.
The things that can be done to prevent carpal tunnel syndrome include drinking enough water, losing any extra weight, eating healthy, nutritious foods, getting medical treatment for any other problems that might cause carpal tunnel syndrome, managing your stress, and taking frequent rests and breaks from any repetitive movements you do.
Here's a simple exercise you can do to help prevent carpal tunnel syndrome. Extend both arms straight out in front of you. Extend your wrist and fingers back as if directing traffic to stop. Hold this position for 5 seconds. Now straighten your wrists and relax your fingers. With your arms still straight out in front of you, keep your wrists straight, make a fist, and squeeze it tightly. Hold this position for 5 seconds. Keep your fist clenched and bend your wrist down. Hold this position for 5 seconds. Straighten both wrists and relax your fingers again. Repeat 10 more times. Now you are ready to begin your workday.
If you follow these simple precautions, you could be
One less.
One less.
One less.
One less.
with carpal tunnel syndrome.